everybody. I'm Suraya Hassan, your educator for today. So welcome aboard as we will learn about reproductive health nursing. We are happy to have you guys in this course and stay tuned. As for the learning outcome for this module, it will provide fundamental knowledge about male reproductive health system and the disease related to this system. We really hope that you can benefit from this course, and without wasting any time, that begins. So in this course, you will learn few types of disease of male reproductive system. So the first one is benign prostatic hyperplasia. In this picture, you can see the normal prostate in the left side, and at the right side is enlarged prostate, which it compressed urethra and might disturb the urination process. So benign prostatic hyperplasia is a benign enlargement of the prostate gland. It is a result of a combination of aging and increase of dihydrotestosterone DHT level, which is a hormone in males, which cause the glandular units in the prostate to undergo nodular tissue hypoplasia. Hypoplasia is an increase in the number of cells. So for the treatment for BPH is medication treatment, which affect prostate and bladder. For the prostate, the drug to relax prostate is alpha blockers, and another drug to shrink prostate is 5-alpha reductase inhibitors. And for the bladder, it is a bladder muscle relaxant, which is anticholinergics. So for 5-alpha reductase inhibitors, the example of the medication is finasteride and dutasteride. So this drug works by reducing the size of the prostate gland, and it is also an enzyme inhibiting agent that the patient DHT level will decrease and it will reduce the enlarged prostate. So for alpha blockers, which is alpha adrenergic receptor blockers, these drugs selectively block alpha adrenergic receptors, which are abundant in the prostate and are increased in the hypoplastic prostate tissue. So this drug promotes smooth muscle relaxation in the prostate, making urination easier. The example of this drug is silodosin, alfuzosin, doxazosin, prazosin, terazosin, and tamoxifen. Sometimes the doctor will combine the drugs therapy, and doctor might recommend taking an alpha blockers and a 5-alpha reductase inhibitor at the same time if either medication alone isn't effective. As for the anticholinergic drugs, agents are effective in relieving overactive bladder symptoms in patients without bladder outlet obstruction. The medications such as dariphenazine, bezaterodine, oxybutynin IR, and propivaline. For the medical management for BPH, immediate catheterization if patient cannot void, and also the urologist may be consulted if an ordinary catheter cannot be inserted. And a suprapubic cystostomy is sometimes necessary, and watchful waiting to monitor disease progression will be done, which is closely watching a patient condition but not giving any treatment unless symptoms appear or change. So patient may be given certain tests and exam during this process. As you can see in this slide, the picture shows the suprapubic cystostomy procedures. The list shows the procedures to destroy excess prostate tissue such as transurethral needle ablation (TUNA), transurethral microwave therapy (TUMT), interstitial laser coagulation (ILC), contact laser prostatectomy (CLP), electrovaporization of the prostate (EVAP), and lastly transurethral resection of the prostate (TURP). As for the transurethral resection of the prostate (TURP), actually the surgeon will insert a resectoscope As you can see in this picture, it's actually an instrument similar to a cystoscope but with a cutting and cauterizing loop through the urethra. So the enlarged portion is then removed in small pieces. We call it is prostate chips. For the surgical management, patient undergo surgery. For preoperative care, assess patient anxiety and provide adequate information, and remind patient to take anticoagulation drugs to prevent bleeding, and administer antibiotic to treat infection. Also encourage patient to take high fluid intake 2 to 3 liters per day, and inform the patient that surgery may affect sexual function, and restore urinary drainage by inserting urinary catheter, and 10 ml of sterile 2% lidocaine gel is injected into the urethra before insertion of the catheter. The gel not only acts as a lubricant but also provides local anesthesia and help open the urethral lumen. So, if a sizable obstruction of the urethra exists, the urologist may insert a filiform catheter with sufficient rigidity to pass the obstruction. So, for the post-operative care, a urinary catheter will be placed into the bladder, and traction is applied on the catheter for patient having a TURP by pulling it taut and taping it to the patient abdomen or thigh. If the catheter is tapped on the patient thigh, instruct him to keep his leg straight. But patient with a TURP may have a catheter and continuous bladder irrigation for several days. So the bladder irrigation is done to remove clotted blood from the bladder and ensure drainage of urine. The bladder is irrigated either manually or on an intermittent basis or more commonly. So irrigation is sterile saline solution or another prescribed solution, and blood clots are expected after prostate surgery for the first 24 to 36 hours. And large amount of bright red blood in the urine can indicate hemorrhage, may occur from displacement of the catheter, dislodgement of a large clot, or increases in abdominal pressure. So ideally, the urine drainage should be light pink without clots, and monitor and record the color, consistency and amount of urine output. And the catheter is often removed 2 to 4 days after surgeries, and the patient should urinate within 6 hours after catheter removal. Now we go to the other disease, which is prostate cancer. It is the most common type of cancer in men and occurs in the prostate. Prostate is actually a small walnut-shaped gland in men that produces a seminal fluid that nourishes and transports sperm. For the surgical management, patient with prostate cancer, radical prostatectomy will be done, which is an operation to remove the prostate gland and tissue surrounding it. And the seminal vesicle and some nearby lymph nodes are usually involved. So there is 2 types of radical prostatectomy, which is open prostatectomy and also robot-assisted radical prostatectomy. For the nursing management for patient undergone surgeries for prostate cancer, for preoperative care for a 24-hour period prior to the date of surgery, ask the patient to drink only clear fluids. And 1 week prior to the date of surgery, make sure that the patient does not take any medications such as aspirin to avoid bleeding. And make sure the patient takes on 1 fleet enema in the evening the day before the procedure to help clean the intestine and reduce the risk of infection. For the post-operative care for patient undergone surgery, is provide meticulous care of the catheter and tube to help heal the bladder or urethra, or to help to reduce the side effect of the treatment. And also preserving patient nutritional status by controlling consumption and supporting protein and calorie-rich foods and avoiding gas-causing foods. Ask the patient to avoid from doing vigorous activity, and tell patient that he or she can take a warm shower to decrease muscle ache for 24 hours after the surgery, and observe wound from any potential complications such as hemorrhage and infection. For other treatment for prostate cancer is radiation therapy, which uses a high power energy to kill the cancers, It can be external beam radiation or brachytherapy, and also the hormone therapy to stop the body from producing the male hormone testosterone, and also the cryosurgery, which an extremely cold liquid or an instrument called a cryoprobe is used to freeze and destroy the abnormal tissue. So for the other treatment is a chemotherapy, which the drugs are used to destroy cells that expand quickly, including cancer cells. So chemotherapy can be administered through a vein in your arm, in pill form or both. So another treatment is biological therapy, which is immunotherapy, using the immune system of the body to fight the cancer cells. In terms of pharmacological management, there are few drugs that used to treat the prostate cancer, which is abiraterone acetate Zytiga, apalutamide Arliada, and bicalutamide Casodex, and the dosage and the side effect as you can see in the slide. And also the other drugs is darolutamide, Nubica, flutamide, Dilexin, nilutamide, Nilandron or Anandron, and the dosage and the side effect as you can see in the slide. So that's all for part 1. We will continue in part 2.